Okay, let's go through a very common movement. So this is a bird dog, one that you've probably used many times or been given to try at home, but there's still a correct way and an incorrect way to do this. So Garrett, on an incorrect bird dog, kind of show me some of the things that you'd see or we see in the clinic here. So there it is, getting a lot of rotation. His spine is rotating to the side. He's falling to one side. He's not keeping it controlled. There it is, like that. Getting a lot of rotation, or the lumbar spine is getting a lot of like flexion or extension, excessive flexion or extension. So when we do this one correctly, we really want to think about keeping that spine in neutral right there, locking it in, all right, and then slowly and controlled go, yep, so he's going right arm, left leg. Look at it, perfectly flat like a tabletop, not moving, not wavering. He's not allowing his body to twist or fall down into that motion or gravity. He's holding it, activating the glutes, activating the shoulder, nice with purpose. He's slow and controlled using that movement. So fantastic.